Hi, Dr. Tidwell. So we're here today with Dr. Tidwell from BioVentus, and she's going to talk to us about osteobiologics today. We're going to be doing this live on Facebook, so if you have any comments, please let us know in the comment box, and we'll have Dr. Tidwell answer as many questions as she can in the time allotted, all right?
Okay.
All right, so first question we have for you, Dr. Tidwell, is can you tell us about your passion for osteobiologics and the background to doing it for a living?
Right. So my passion probably started with a love of medicine, and actually it was here in Washington State where I was a volunteer wildland firefighter and became an EMT. And so that kind of sparked my interest in just emergency medicine and the response of responding to tissue repair. And in graduate school, I studied neuronal survival and then moved into a postdoc doing spinal cord injury and repair. And so that sort of started my interest in how does the body heal itself and what can we do to augment that repair. And about 5 years ago, I moved into ortho biologics industry, and I've been looking at the role of the cells and the biology of all the different components that contribute to healing.
Great. Awesome. Next question is, what are the current trends of osteobiologics specifically?
That's a broad question. So I think some of the trends. So right now there's about 5 major categories of orthobiologics, and what I think we'll see moving forward are brand new categories. But some of the trends really are what we're seeing is incremental improvements, not necessarily true innovation. I think we have yet to see true innovation. So right now, some of the orthobiologics, for example, the allografts, that has to still remain within a minimally manipulated tissue category that's regulated by the FDA, and so you can only push that limit so far of staying within minimal manipulation. And so I think what we'll see the trend moving forward are basically moving beyond that, so that we will start to see manipulation of products that will be regulated in a whole new way.
Great. All right. Next question is, why do you osteobiologics remain a hot topic for many reasons, mainly in terms of lack of regulatory definitions, but also due to a lack of understanding by so many. For a relative lay population, what are the basic categories of bone graft substitutes?
Right. So the basic categories are allografts. So that means bones, and as far as bone grafting, that means tissue that has been donated by someone, and it's prepared and processed and then made available to a patient to receive. So typically those are that's bone tissue, and then a subset of that are the stem cell allograft bone, where they've preserved viable cells that are not immunogenic and made available to patients. So that's sort of the overall category is allografts. Stem cell allografts is a subset of that. The other category would be the synthetic bone graft materials. So those are composed mostly of bioglass, ceramics, and polymers mixed in with those. And what we're seeing is this blend of different compositions combined together. And then another category is the cell and marrow space. So there's not so much products that you use to put in a person. It's more of the devices that are used to extract and aspirate the bone marrow aspirate from the patient itself, given back to the same patient. So that's an autologous use of your own bone marrow to help improve the process of bone healing. And then the other category would be the recombinant human growth factors. that are used when they're combined with a scaffold. And so, for example, recombinant BMP2 is the most well-known growth factor, and that helps direct the differentiation of osteoblast cells to produce the osteoid matrix. So the growth factor category is another one.
Okay, great. Thank you. All right, next question is, what questions should people ask when they make a purchasing decision about bone graft substitutes?
So some of the questions that should be asked are, what are the biological features that bone graft option provides? And then what is the scientific or clinical evidence to support their use? So, has that product been compared to the gold standard of autograft? Has it been compared to other types of bone grafts in the market? So, first of all, what is the bone graft offer biologically, and what type of data do you have?
Have there been any reports about disease transmission from osteobiologics since the initial HIV scare has died down?
So the risk of disease transmission really is not a concern anymore. So the regulatory agencies have done a really good job of ensuring that that's no longer a concern. It's from a regulatory perspective, but also AATB has set standards for each tissue bank. So it's just really kind of a non-issue.
Okay. All right. Is autologous iliac crest bone graft still the gold standard, or are there more potent agents to achieve bone helming out there now?
So I think that's a question that everybody has in their mind now in today with so many different orthobiologic options out there. Autograft has been considered the gold standard, but I think now people are asking, what is the gold standard today?
Do you have an answer for that?
No, I don't.
What about from your point of view, or from Bioventus as a company? Do you guys? We don't have to go into that.
So I would say, again, I think it's more of what does the field believe is the new gold standard. Autograft has been used as a gold standard because it has all of the biologic components necessary for bone healing. So will we ever achieve an orthobiologic that has all of those features that makes a clinically significant difference compared to autograft? I think we have yet to see that.
Okay. All right. So stem cells hold a substantial fascination with the public as a cure all for many maladies. How important are stem cells for bone helming, and how can they be differentiated to heal a damaged spinal cord?
So I actually have a little bit of experience in this because as a postdoc, I did spinal cord injury and repair using embryonic spinal cord tissue. There's that using stem cells for spinal cord injury repair is still being researched. There are some companies out there now who are actually working on products to use stem cells in spinal cord injury repair, but it's still in the works.
Okay. Question on Facebook: how did you get into this field?
I started back in graduate school by studying neuronal survival, and then as a postdoc doing spinal cord injury research. But it took a while for me to find the world of orthobiologics. I spent about 9 years doing intellectual property, and so I knew a lot about different types of new technologies in different spaces. But I eventually found the role of using autologous bone marrow in the space of orthobiologics, and then I started to learn more about all the different types of bone grafting options. So it wasn't like one event kind of led me to this field. I've been building my knowledge for several years now.
Okay. If somebody was interested in getting into this field, what would you maybe give them advice, or where would you tell them?
Right. So I guess it depends on, what role do you want to play.
Mm-hmm.
So for my role, essentially I serve sometimes as a medical science liaison and in going to different venues and speaking about the role of orthobiologics to surgeons. So it's peer-to-peer education, and so that would require an advanced degree so that you're seen as their peer, and then having your studies focused on tissue regeneration and in the orthopedic space. So you kind of have to start that strong foundation, scientific foundation, and then start to find opportunities to speak to surgeons in a peer-to-peer way. So there's no definitive set, check boxes, to get from point A to point B. But you definitely need to have an advanced degree. You need to have a good understanding of the space, and then you have to have the ability to communicate. So I teach 20-year-old sales reps, but I also share knowledge with 65-year-old surgeons, and I love that.
That's great. Awesome. We got another question. Is autologous iliac crest bone grafts? Oh, I already asked that one. So, how has the interest affected intellectual property? Oh, how has the internet affected intellectual property?
Right.
Sorry.
I think the internet has just basically provided information to everyone. So as far as preserving intellectual property in today's world with the internet, you have to be careful with what you share. So, while some people want to share everything, you have to be very careful. If you're going to try to preserve your own innovative ideas, then you have to keep that close.
Excellent. All right. It looks like there's no more questions on Facebook, so thank you once again, Dr. Tidwell, for coming to SSF and talking to us. It's been very enlightening. Thank you once again.
Well, thank you.
Thank you.